My name is Sakina Oyuhuru. I am a home birth midwife and I practice in New York City for the last 14 years, and then I moved here 7 months ago to Charlotte. So this is the first of many events that myself and Fametta Darling will be having here in Charlotte. I have a nonprofit called A Woman's Way, and A Woman's Way is a nonprofit that offers women educational forums that focus on tools to help them reduce their risk for maternal mortality and infant mortality. My vision was to reach a broader population. I know there's women out there that could benefit from our statistics, and we have excellent statistics in terms of maternal mortality, C-section rates, episiotomy rates. So this is part of my vision. And so we're raising awareness about the model of midwifery and about doula services. I'm going to let Fametta talk a little bit about her organization, but we are a collaboration. This is my sister, and if it wasn't for her, we wouldn't be doing this event.
So my name's Fametta Darling. I'm a local doula here, birth and postpartum, and I have a for-profit business, My Darling Doula. You probably saw that. Here in Charlotte, women of color, specifically black women of color, and really all around the United States, are dying at a rate 3 to 4 times higher than white women. In addition to that, our babies are dying at a much higher rate. Wise Community Doulas is a grassroots organization created specifically for the women here. We have partnerships with local family practices. We support women during pregnancy and birth and beyond. Here in Charlotte, a doula service can start at $600 and can go up to $2,500. So we offer those services free and at a sliding scale. And also we have doulas who are new, who may not know how to navigate the doula world, and we provide training for them as well.
What's the difference between a midwife and a doula?
I do not touch anything that the doctor would touch, so to speak. I am all the external help. I am the emotional support. I am the girlfriend that's not your girlfriend help. I am the cheerleader, the coach. I provide no medical intervention. I provide medical education and opportunity for you to learn, but I don't do any medical intervention.
Yeah, so as midwives, we do the other stuff. So we are checking blood pressures. We're making sure that mom and baby are healthy, intervening when necessary to ensure their health, keep them well. So during pregnancy, we provide prenatal care. So what that can look like is a ton of education. Of course, all the vital things, checking your blood pressure, checking on any lab stuff that needs to be done, feeling for things like, is the baby growing appropriately? What do we need to do to make sure the baby is or isn't? Is the baby breached? So all this sort of medical side of things, but we also provide a ton of emotional support, a ton of education. Also as a nurse midwife, I also provide gynecological care. Women come to us for their pap smears, their well woman exams every year, and breast exams and all that stuff. I'm a primary care provider, so I do that. We also can take care of babies for up to 28 days after they're born. So we do some newborn care as well.
If you are a midwife that practices within the hospital, like I always have, you do have the opportunity to expand your practice to things that the mom may want, to be able to include that. Like my training will now include circumcision. Not everybody agrees with it, but some people still want it, so I want to be able to offer it. On the medical side, colposcopies. That's a medical intervention that I'll be able to do. I do C-sections with the physician. I'm the second person at the table. So you have the ability to support her one step further, as opposed to, like she said, with a medical condition that sometimes we have to turn over. Some have the ability to go that extra step and to be there, if nothing else, for support.
They say like 40 to 60% of these deaths we know can be prevented. And then there's a whole other portion that people don't know why. And a part of it is we believe because of a weathering effect, the weathering effect of racism, which is not just when you walk into that provider's office and they dismiss you or being treated poorly in that moment. It's the cumulative effect of living in this world.
It's just about sometimes you're brown and you're not being taken, you're not being given the same opportunity and the same respect as somebody who's not brown.
When people have providers who look like them, they get better health outcomes. We know that about pregnancy, we know that about primary care. That has been validated by studies already.
You have a higher rate of patient satisfaction and better outcomes when patients are looked at as a partnership, and that's what the midwifery model is all about. So we look at it as a partnership.
This is why our self-care is of paramount importance. And so it sounds frivolous to say that we have to take care of ourselves. It sounds like some sort of luxury or something to take lightly to say that we really have to have a mindfulness practice. We really have to tune into our bodies, tune into ourselves, and really practice good health.